Thank you very much. I have slightly changed the title of my presentation. And I did so on the basis of Alberto's request. I would like to thank the Institute of Oncology for having invited me. I thank you all. There are many friends among the audience that I'm very happy to see after some time. Now, I have an obligation of the Loyola University to say a few words about our universities. There are 4 medical schools throughout the United States, and let us say that perhaps we are the medical training institutions among the most important in the United States. Loyola is the last one that was reconstructed, and therefore I would like to consider it as one of the most important and modern in the United States. I deal with oxidation and dementia. Therefore, I started investigating oxidation starting from dementia, and that happened in 1975. And I never wanted to deal with cancer and oxidation for a very simple reason, that there are some forms of cancer that produce antioxidants, while there are others that do not produce them. This means that you have to be extremely careful when you administer antioxidants to cancer patients, unless you are capable of assessing the oxidating stress in the right way, because otherwise you would cause damage. Not only when you speak of oxidation, it's like speaking about God. Everybody has their own opinion on the subject. But even assessments and controls. My colleague before me said that wine is the most highly antioxidating product, but I don't agree with this, because the antioxidants that are in wine are not the natural ones, but they're the ones that have been added to wine. And I think that that is where the antioxidating power is, and if anything, you should avoid drinking it. However, I'm sorry, I missed the comment because it's out of the microphone. You can include up to 150 milligrams per liter of antioxidants, up to 200 milligrams per liter according to the years, on the basis of a waiver. Sulfite is well, this is a very nice discussion on wine, but perhaps we can carry on the discussion later on at the end of the session. It sounds very interesting. We'll most certainly pick it up again. This is the roadmap: oxidation, the production of passive and active oxidation, the status in normal subjects, the method to determine oxidative stress, and here, you should thank Lanfranchi for this, I decided to include oxidative stresses in one particular type of cancer, which is colon cancer, and we investigated what happens in that particular condition. We all know that we have the antioxidating balance. We all know that oxidating stress comes because there is imbalance between oxidation and antioxidation, and it's the usual story. Special reactive forms of oxygen occur in different ways: energetic, when I produce energy; reactive, when there is an inflammatory process or an infection underway; and metabolic, which occurs when I need to produce certain substances. This is what happens in the mitochondria from oxygen. Isn't there a pointer that I could use, perhaps? So from oxygen, we achieve the water, and during this transfer, a whole series of reactive species are formed. which are always present in a smaller or larger amount in the mitochondria. This is a reactive pathway with a morphonucleate. There's a captation of oxygen, then there's a conversion of hydrogen peroxide, which is highly oxidating, and then we get to the radical hydroxide, which is the most powerful antioxidant that exists, but it has a very short half-life, and it's very reactive. And then we have the metabolic pathway. You have the hypoxanthine, dopamine, and arachidonic acid. These are a whole series of enzymes that are capable to produce reactive oxygen species. And you can see that we go from the main membrane to the internal corpuscle and to the nucleus. This means that we have to cohabit with oxidation, so much so that there's a paradigm. This is oxidation. When there is no oxidation, there's no growth, and when there's too much of it, there's death. There's an intermediate level. When it's reduced, there's incomplete growth. When it reaches a certain level, there's mitogenesis. When it goes up too much, there's growth, arrest, and death. This means that we have to remain within a very balanced situation. Everybody knows this. These are the substances that are most sensitive to oxidation: lipids, antiproteases. These are anticoagulant enzymes. Antithrombin 3, for example, that it's an antiprotease. So when I have an oxidative stress, I have a push towards thrombosis. For example, women who take the anticonception pill know this very much. I've always told my students that these are the less superficial thrombosis because oxidating stress pushes towards coagulation. Let us now, however, enter the context of oxidation and consider it in a broader way. There's a form of oxidation that might be called passive oxidation. That is to say that the functional components become oxidated due to the environment. And this is the case of the propagation of oxidation when a membrane lipid has become oxidated and it tends to oxidate the neighboring ones through propagation. In this case, I can face this type of oxidation with the antioxidants that I have in the environment. If I have a beta-carotene on a membrane or vitamin E, I can somehow compensate for the oxidation. This is a typical passive oxidation of a membrane. I have an alteration of the membrane. I have sodium, which enters it. The sodium-potassium pump has to push it out because the membrane is made in such a way that it must prevent sodium from entering it. So what is appealing for vegetables, for example, might not be appealing for man. And you can see how the phytosteroids are pumped out. So what happens? Sodium out, potassium in, out, in, and the pump goes like this all day long. And to do this, it consumes energy. And if there's too much sodium, it has to pump more, and it produces more reactive substances. This is passive oxidation.